Okay, perfect. So, good afternoon, everyone. My name is Giulia Mangiameli. I work as a project manager at the School of Public Health at Imperial College London. And today I will give you a brief overview of our project, Pathways to Equitable Healthy Cities. So, with Pathways, we work in 6 cities around the world. In particular, we work in Vancouver, we work in London, Tamale and Accra in Ghana, Dhaka in Bangladesh, and Beijing in China. The main research objective of Pathways is to develop and evaluate policy that have equity at their core and that are adapted to our focus cities and contextualized. In terms of our research agenda, we have 3 main aims. We aim to measure and characterize complex urban environments in a spatially, temporally, and socio-demographically sensitive manner. So we look at different city-related aspects, including housing, transport, access to services, built and natural environment, and sanitation and water. We also aim to measure and characterize complex health outcomes in a spatially, temporally, and socio-demographically sensitive way. And in particular, we look at multiple causes of death and disease and developmental outcomes. And third, we aim to predict and measure the impact of policies in disruptive changes on inequalities. So in terms of how our project is organized, we are organized with substantive and methodological groups. We have housing and neighborhood at our core, interlinked with urban services, transport and mobility, and water and sanitation, in a framework that takes into consideration poverty and social inequalities, as well as health outcomes and inequalities. And this is embedded in a larger framework where we co-produce knowledge with our policy, civil, and society partners in different countries, and with an overall integration, methodological integration through our methodological work groups that look at measurement and monitoring or analyzing big data and policy modeling. In terms of our work in the UK and in London, we mainly work with, so we work both with more traditional and more innovative data sources. So we use data from the Ordnance Survey, from the Department for Education and the National People Database, and environmental data in terms of air and noise pollution that are held at SASU, which is the Small Area Health Statistic Unit here at Imperial College. We also use civil registration data on deaths with information on the place of residence that are also held at SASU. And we use more traditional survey data and census data. And we also use more innovative data sources such as imagery, in particularly from Google Street View and satellite images. So the challenges for us are the limited and partial data availability, the fact that there is no central data repository, and the fact that the records are mixed on measurement validity and comparability. And our approach is to leverage emerging and classical data sources and to collect primary data strategically when needed, and also to use multiple sources to input missing data and adjust for bias in comparability. In terms of our work in London, so we have worked to track environmental health inequalities at high spatial and temporal resolution in cities. And we have used and still use unstructured data in the form of imagery and their associated survey and census data. And to do this, we have developed a deep learning method that basically uses these data to track health inequalities and their environmental, social, and healthcare causes. This is an example of research published in our group. This is research by Ezra Sewell, who developed a deep learning model that was trained with census data and then was able to identify patterns from images coming from Google Street View and was able to predict health outcomes with very high accuracy. In particular, it was particularly good in predicting deprivation, both living environment deprivation, as well as health deprivation and disability, but also outcomes such as mean income. This model is less good in predicting outcomes that are not directly related to spatial features or features of the living environment, because it's based on the analysis of Google Street View images. And we are now using the same model to quantify health inequalities in space using satellite images. And this is thanks to our collaboration with partners at NASA. In terms of data sharing, we share all our outputs online and also our code on our website. And we will also be able to present posterior estimates of life expectancies for all England at MSOA level and for London at LSOA level. And this is part of our wider work on life expectancy inequalities that is led by James Bennett in our group, and which has informed in the past both the annual report of the Chief Medical Officer as well as the Teton review in the past few years. And this was just a brief overview of our work.